Now, joining us to talk about building an equitable and healthy nation is Dr. Jerome Adams, former Surgeon General.
Hey, Dr. Adams, how are you?
You are the hardest working man in D.C. today. I'll tell you what.
Yeah, up early, but we have a great staff. I'm just a prop, as I say. So you were at an event a while back, I can't remember exactly when, and there's a lot has happened since then. I want to start out with a big, vague question, because I know your wife has had some issues. We've also had some issues with you working for the Trump administration. But first, I want to say, what were the takeaways and what surprised you during your time as Surgeon General?
Oh, my goodness. Well, first of all, and this is self-promoting, I have a book coming out in November called Crisis and Chaos, and I talk about a lot of the lessons learned because we won't be able to cover them in 15 minutes. But I hit some high points.
I like that title. It's very catchy.
Well, that's what the publisher said. I wanted to call it something different,
Okay.
but they wanted to make it attractive. But a couple of quick points that we cover in the book and that I think people don't always appreciate. Number one, you can't make good decisions if you don't have good information. And there's a lot to unpack there, but all the way back in the beginning, and Tony talked about this earlier, we weren't getting good and transparent information from China. So a lot of our early decisions were based on what we thought the coronavirus would do versus, excuse me, what it was actually doing on the ground. We also, and we just got to own this, we didn't do a good enough job standing up testing. Other countries beat us to testing, and so we did not know what we didn't know because we couldn't track testing. We couldn't see the virus. And I would argue to this day, we still don't have a good testing policy. We don't know what we don't know because we've essentially stopped testing. One of the biggest surges under the current administration was during the Delta wave when the administration didn't test. So important to know that we can't make good decisions if we don't have good information. And then finally, with the ending of the public health emergency, and I had an op-ed about this, CDC lost a lot of their reporting authorities. And so we weren't getting the information that we needed. That's number one. Number two, COVID is not the problem. COVID was just a magnifying glass on the problems that have existed for decades, for centuries, health inequities. The same people who are predisposed to dying from COVID are the ones that are predisposed to dying from liver disease, from cancer, from opioid overdoses, from infant and maternal mortality. It was a magnifying glass. It was a magnifying glass on vaccine hesitancy. It was a magnifying glass on misinformation. It wasn't the problem. And if we really look at COVID as a fire to be put out and say, okay, COVID's done, let's move on, then shame on us. So that's number two. And then the final point that I would make that I don't think people appreciate. We were sold on this idea in 2020 that if you just changed the person who was at the captain of the Titanic, we weren't going to hit the iceberg. The truth is that factually, more people died in 2021 than in 2020. We had more infections. We saw more of the same in terms of policies. The tone did change from administration to administration, but the outcomes didn't. And this is not me saying shame on the Biden administration or casting aspersions on them. It's saying that if we make everything about Trump and we make everything about one administration versus the other, then we're missing the broader point and we're setting ourselves up to fall victim to the same challenges over and over and over. And you saw this with Mpox. We should have hit Mpox out of the park. We absolutely should have hit Mpox out of the park because we were in batting practice for 2 years. Mm-hmm. And we made the exact same mistakes over again with Mpox in terms of poor communication, in terms of not standing up testing, in terms of not being able to distribute vaccines and treatments to people. So it just shows that we aren't learning the lessons because we always want to say it's Trump's fault, it's Biden's fault, instead of looking at the underlying issues.
You mentioned Trump, and you've said publicly that, as you know, Donald Trump is running for president again, that him running again in the 2024 campaign is going to make your life harder. Why?
Well, so what's interesting is if you go all the way back to 2019, the head of CBS famously said, Donald Trump is bad for America, but he's great for CBS. He said that. You can look it up. The media is addicted to talking about Donald Trump because it is good for them. How it impacts me. I can't do a news story to anywhere without them putting as the headline, Donald Trump's Surgeon General says. It's not a health story. It then becomes a political story. And that's me, but it's impacting our ability to have rational conversations about important issues that, again, are about so much more than Donald Trump. And that's really the point I make in my book. I literally say in the beginning of the book, this book is not about Donald Trump. And many people wonder why it took so long for the book to come out. No publishing company wanted to publish it because they wanted a book that was all about everything Donald Trump did wrong. I mean, and that's the challenge that we continue to have, and again, that sets us up for the same thing all over again.
Your wife has battled melanoma. Can you update us on that? Another thing you've talked publicly about, what did you learn from that battle, which has been ongoing?
Well, what's interesting is during the pandemic, for many of you all, for many people, I was a figurehead on TV. But I was the first Surgeon General in modern times to have school-age kids. So I was literally dealing with homeschooling and trying to figure out, do we have enough broadband access, bandwidth? Do we have enough computers? Can we put the kids in different places so they can learn? I understood this in a way that a lot of, quite frankly, our decision makers didn't. And I was one of the earliest people to say, hey, we got to figure out how to get these kids back in schools, and/or we have to give people the resources to be able to adequately do homeschooling. So I mentioned that because we started talking about family. But my wife, many of you know, has stage 4 melanoma. And she had a recurrence during the pandemic. And we'll never know to what extent the pandemic impacted her, but I know that her PET scan was delayed because of the pandemic. We know that it made it difficult for her to go in and get treatment during the pandemic. So again, these concerns that people raise about pandemic policies impacting broader health issues are valid, and I understood them in a very personal way. My brother, who I've also talked about, while I was standing in the White House next to the President of the United States, he was sitting in a prison cell about 25 miles away in Jessup, Maryland, due to crimes he'd committed to support his addiction. They actually released him during COVID because a lot of people got released, but then he couldn't get treatment. And so in a very real and tangible way, I understand the frustration that many people have when they hear and perceive themselves to be at low risk for COVID, but see very real health issues popping up, mental health and physical health issues popping up in their communities and their friends and their family related to their inability to access care because of COVID policies.
Why is what is the solution? And I know it's not going to be done tomorrow, but healthcare is so polarizing. We're living in such polarizing times. It's not like nothing gets done on Capitol Hill. The Cancer Cures Act was passed a while back, and there has been bipartisan healthcare legislation, but it's harder to move. How do we, we were talking about the protesters outside for Dr. Fauci. When is this going to change? Can it change? How can it change?
It can change, and it has to change. And let me tell you why it has to change and why it will change. I've talked to health economists, and healthcare being 20% of our GDP is about the breaking point. At some point, you can no longer continue to grow an economy when healthcare is 20% of your GDP, because that means a lot of your people are getting sick. Your workforce is getting sick. And one of the things we were talking about in the green room is one of the rare places you can get bipartisan agreement now is around the workforce crisis that we have in our country. Why do we have a workforce crisis? Too many people have checked out because of the opioid epidemic. Too many people are checking out early on in their 60s and even now in their 50s because of multiple chronic diseases. Too many people are checking out because of long COVID. This is no longer a health crisis and an individual problem. This is a societal problem. So I actually saw this coming, and when I was Surgeon General, before the pandemic, I wrote a report along with the Chamber of Commerce, the UVA Darden School of Business, and others that was unlike any report a Surgeon General had ever put out. Why? Because it wasn't written for a health audience. It was written for a business audience. It was called Community Health and Economic Prosperity, and it was making the case that health matters to our economic success in this nation, and that businesses have to lean in. And to get to the point, I think the way this changes is when you have Jeff Bezos, when you have Elon Musk, when you have Mark Zuckerberg saying we need to have more inclusive workplace policies, we need to have paid time off, We need to have flexible work schedules. We need to build healthier communities because it actually helps us retain and recruit and retain employees. It lowers our healthcare costs. Do you know that for Fortune 500 companies, the number 2 expense that they bear is healthcare? Again, it is not sustainable, and the business community is starting to wake up to that fact. They're locating their companies in states that have higher health or better health outcomes intentionally because they want that number 2 cost to be lower. And states are starting to see that, and they're starting again to build healthier communities. I think that's going to be the nidus for change. It's not going to be an individual, hey, this is the right moral thing to do. It's going to be a, hey, we can no longer remain successful as an economic entity if we don't pay attention to health.
Tell me about writing the book. I know you mentioned that it wasn't accepted by some publishers at first, but was it cathartic?
It really was. So what's interesting is I got to see everyone else's books come out. Deb Burke's book, Scott Gottlieb's book, Brett Giroir's book. They're all friends, and they all sent me signed copies, and I go through and I see the different narratives. For me, my book is part memoir. And when I say part memoir, I was just the second African-American male Surgeon General in history. That was pretty significant, pretty historic. And it's interesting because so many people said, why did you stay? How could you work for that administration or that man? Why didn't you leave? As the second African-American male Surgeon General in a community, and you heard on the last panel where we have fewer black males graduating from medical school now than we had 40 years ago, you ask me, how could I stay? How could I not? How could I not stay? How could I not take advantage of that opportunity? And I would argue when you disagree with an administration, that's when it's even more important that you have people at the table who look like you, who think like you, who can speak up to your issues. And that's a lot of what I actually did on the COVID task force. So this is what it's like for my wife at home trying to raise kids. This is what it's like for my brother who's incarcerated. This is what it's like for populations who aren't always heard. There's a saying, if you're not at the table, you're on the menu. I wanted to be there, and that book talks about being at the table and the real challenges of being at the table. It was hard. It was hard because I was getting beat up by the very people who I was at the table trying to support and trying to fight for. I also give you some perspective about what was happening, but I don't do it from the standpoint of absolving myself from blame. We all have plenty of blame to share in this, but I try to give people some insights that will help us avoid these problems in the future. And one of the insights, for instance, is that I'm a doctor. When you ask me to explain something, I'm used to getting behind a podium and pulling out my 50-slide PowerPoint presentation and walking you through the nuances. That's a very different environment than when you're going on CNN with Jake Tapper, and he says, Donald Trump forgoes mask. He's going to have a big rally, and our experts say it's going to kill thousands. Coming up next, Donald Trump, Surgeon General, to explain. And that's literally how my media interviews would go. And the point I'm making is that we need to prepare health professionals for an environment where that's the type of discourse that you're having. We need them to prepare to be on Twitter and TikTok. I have a very robust Twitter presence, as many of you all know. And I think it's important because most people, health professionals included, say they get the majority of their health information online. So if we're not there and we don't know how to be effective in that space, we're going to get our lunch handed to us by Joe Rogan over and over and over again. And so I talk about that. But I also, again, try to make it very practical and say, here are the lessons learned from, again, the lack of information to how we engage with the media, to our failure to pay attention to health inequities, to challenges about trade-offs when you look at schools. You can't run a school without teachers and bus drivers. So what are the rights of the students to be at school versus the rights of those teachers and bus drivers and cafeteria workers to be safe? We talk about these things in a way that is much more nuanced than, again, 3 minutes on CNN or 3 minutes on Fox News.
Last question, a lot of healthcare stakeholders in the room, also watching online. What would be your advice to them to make the healthcare system better?
My advice, number one, would be healthcare is not health. Only about 80% of only about 20% of your health is determined by your access to health care. So we need to think outside the box. We need to think about our built environment. We need to think about houses people live in. We need to think about the parks and green spaces that exist around individuals. We're here talking about diabetes and obesity, and I love talking about my daughter, and I promise I won't drone on, but my daughter spends a little bit too much time on TikTok. And when she does, I say, Millie, give me your phone, go outside, I don't want to see you for an hour. She's 13 years old. I can do that, and that makes me a good dad, because she's out getting fresh air, she's getting exercise, but I live in a nice neighborhood. We have complete streets, full sidewalks, all the neighbors know her, there aren't drug dealers in my community. Different dad, 6 miles south of me on the east side of Indianapolis, tells his 13-year-old daughter, give me your phone, I don't want to see you for an hour. That's criminal child neglect. And so it's not about whether I love my daughter more than he loves his daughter. It's about the environment that determines people's choices and their outcomes. And so if we want to change health outcomes, we can't keep focusing and doubling down on the 20%. I love Ozempic. I agree that we need to make it more available to more people, but we're not going to solve the problem with Ozempic. Finish with another story about my kids. My 2 boys, they're 17 months apart, and they were living terrors for most of our parenting lives. They're now 18 and 17, and they're now terrors in a very different way because they're both driving. But yeah. I came home from work one day, and there was water coming out of the chandelier in our dining room. So I run upstairs.
Out of the chandelier?
Out of the chandelier.
Okay.
So I run upstairs, and the boys had flooded our bathroom. And so I see water coming out of the bathroom, going to the wall and going down, towards where I can see that the chandelier is. So my first instinct is to grab a towel. And I grab a towel out of our closet, throw a towel down. Towel quickly gets soaked up, grab another towel, grab another towel. Pretty soon, all the towels are on the floor. The water's still coming. What's the problem? I've got to figure out where that water is coming from and turn off the spigot. Well, the problem with our healthcare system is we're throwing towels at the problem. With Ozempic and with naloxone and with all these things that are important, but aren't going to actually help us turn the water off. We need to get upstream and build healthier communities, address social drivers, and we need the business community to understand they have a stake in this because they're going to be able to influence Congress's policies way more. Congress doesn't care when the Surgeon General comes. They don't, and says we need X, Y, or Z. They care, like I said, when Elon Musk or Jeff Bezos comes and says we need to do this. So I would rather have those 2 out there arguing for higher taxes on smoking, for more inclusive communities, than to have, again, the Surgeon General or the HHS Secretary or anyone else out there. So I think that's how we change the healthcare system, is get it focused more on upstream prevention. I love that you had a discussion about value-based purchasing earlier. W. Edwards Deming famously said, every system is perfectly designed to get exactly the results that it gets. Our system rewards sick care. And I say we don't have a health care system. What we have is a sick reimbursement system. Our system rewards people getting sick instead of rewarding them for getting healthy. We need to change the way we pay for health care so that we can focus more on upstream prevention, and we need to get more people, including the business and the military community, and you heard this earlier, 71% of 18 to 24-year-olds in this country are ineligible to serve in the military right now. This is a national security imperative. I would rather have the head of the Army going out there arguing for healthier communities than to have the Surgeon General of the United States. When we can create that inclusive and holistic idea of health and not just focus on health care and downstream Band-Aids and throwing towels on the water coming out of the chandelier, we will be in a much better place moving forward.
Dr. Adams, thank you so much for joining us. Please thank Dr. Adams.
Is my QR code, It's called Crisis and Chaos. Please check it out. I took pains, again, not to make this a political book or a book that's about, hey, I didn't do anything wrong. I really think we need to reflect on again, what COVID taught us. The greatest health advances in history in our country have come not during times of calm, but during times of crisis. And shame on us if we don't use and leverage this crisis to actually reflect on the root issues and create a better society for everyone moving forward.
Well said.
Thanks, Bob.
Dr. Adams, thank you so much.
Thank you, Dr. Adams, our moderators, and all of the amazing guests who joined us today. That brings us to the end of our program. On the behalf of The Hill and our sponsors, Novo Nordisk, Consumers for Quality Care, the Healthcare Distribution Alliance, and the PAN Foundation, we would like to thank everyone who joined us here today, and for those of you who tuned in online. If you missed any portion of today's discussion, the full event video will be available on thehill.com shortly. Thank you very much.